Ever feel like managing your family's health is basically a full-time job? Yeah, you're definitely not alone. So today, we're going to talk about a simpler, way more connected approach to handling healthcare for everyone you love. For so many of us, healthcare feels like this giant, complicated puzzle, and it's like none of the pieces are fitting together right. I mean, does this sound familiar? You're juggling a pediatrician for the kids, a GP for yourself, maybe an entirely different doctor for your parents. The list just keeps going. It's this constant, exhausting juggling act. And it's not just frustrating, right? It causes real problems. Trying to coordinate all those appointments, making sure every doctor has the right medical history, it's a total chore. And honestly, it's so easy for really important details to get lost in the shuffle. Okay, so what if there was a better way? A simpler, more integrated solution? Well, there is. Let's dive into a model that's designed to fix this exact problem. It's called family medicine. So what is it exactly? Well, think of it this way. Family medicine is all about providing complete, continuous care. It's basically having one trusted doctor or one clinic for your entire family, from the new baby all the way to grandma and grandpa. And this really gets to the heart of it. The philosophy is about caring for the whole person, not just the symptoms. It's not just about, treating a cough. It's about understanding everything about you, your lifestyle, your family's history, what your long-term health goals are. What this really does is change healthcare from just a bunch of random, disconnected appointments into a real, ongoing relationship. You get a trusted partner who actually knows you and your family's story. Okay, so that's the big idea. But what does this actually look like in the real world? Let's break down the kind of care you get at every single stage of life. The big focus here is on being proactive, staying ahead of problems. So for kids, that's things like monitoring their growth and making sure they're up to date on immunizations. For adults, it's all about those annual wellness exams and looking at any potential health risks. And for our older family members, it's about supporting things like mobility and helping manage chronic conditions. It can even cover things you might not think of, like getting you ready for a big trip with travel health advice. Now, this is a huge one for so many families, managing long-term conditions like diabetes or high blood pressure. Instead of it being chaotic, there's a clear, supportive process. It all starts with a really thorough evaluation. Then you've got regular monitoring and tweaking medications as needed. And this is key, you get ongoing guidance on lifestyle changes to help prevent complications down the road. And of course, life happens, right? Things pop up. This model means you have a single go-to person for all those unexpected moments, whether it's the flu tearing through the house, a sudden infection, or a minor cut that needs to be looked at. It's all about having that one reliable person to call first. But wait, there's more. The modern approach to family medicine is going even bigger. It's looking at health from a truly holistic perspective. We're talking about going way beyond just physical symptoms to really understand how everything about our well-being is connected. This really shows you the difference. The old school way is to treat an illness when it shows up, which means you end up with a different specialist for every little thing. The integrated approach, it's all about connecting the dots, linking your internal health with your lifestyle, your mental wellness, all with one team coordinating everything. So when we say a 360-degree approach, this is what we mean. It brings everything together. You've got diagnostics, like an ECG to check on your heart, right alongside guidance on lifestyle and mental health screenings. And it can even include things like aesthetic support. Think PRP therapy for skin and hair, because how you feel about yourself is absolutely part of your overall wellness. And let's talk about a huge part of this, convenience. Being able to get minor procedures done right there in the clinic. We're talking about things like draining an abscess, removing a cyst, or getting a few stitches. It saves you so much time and stress. No more getting referred to yet another specialist for something that can be handled right then and there. All right, let's pull all this together. When you boil it all down, this whole approach is about completely redefining your relationship with your doctor. It's about you becoming a true partner in your own health journey. So what's the core promise here? Well, first, it's patient-centered care. That means your plan is built just for you. Second, it's comprehensive. You get pretty much everything you need in one place. And third, it's about continuity. You build a real relationship with a doctor who gets to know you and your family over years, not just minutes. At the end of the day, this isn't just about a series of medical transactions. The real goal here is to build a solid foundation of trust and understanding. It's about creating a true, lasting partnership for your family's health. So that really leaves us with one final thought. After seeing how all this works, how a more integrated model can simplify everything, isn't it maybe time to look for a simpler, more connected way to manage your family's health?